Ladies and gentlemen, we've got a very special guest here. So I ask that you give her your attention, give her your time. Her name is Representative Christina Haswood. But before I have her come up, I'd like to introduce my sister, Pankui Victors Kozad. Pankui Victors Kozad, we grew up together, running around, going to powwows, going to haunted houses. We've been friends since we were this big. So my sister here, she's going to come up and she's going to do an introduction, maybe give a little bit about her background and for people who may not know how she got elected to office. It's an amazing accomplishment, and it's a great thing that she's done, and I'm always happy to see her, and I'm always very proud to introduce her. So let's give her a big round of applause. Pankui Victors Kozad.
Good afternoon. I hope everybody got full. That was a very good lunch. Let's give another round of applause to our native chef. Thank you. It's an honor to introduce our next speaker, Representative Christina Haswood from the Dene Nation. She's started her higher education journey at Haskell Indian Nations University, where she earned her AS in community health, then transferred to Arizona State, where she earned her BS in public health, and then graduated from the University of Kansas Medical Center, where she earned her master's in public health in May of 2020. She was born and raised in Lawrence, Kansas. And I just want to say a little bit more about her. In 2020 is when she was just completing her master's degree. I nudged her to run for office. I served 12 years, for those that don't know, in the Kansas House of Representatives. I was the first Native American woman elected to the Kansas legislature back in 2011. So I was very happy to work with the tribes and pass some good legislation for the state. And an opportunity came up. One of the Lawrence representatives said, "Hey, I'm not running for office. Do you know anybody do you have anybody in mind? I represent the Haskell area that could run for office. Do you know anybody?" And I said, "Oh, yes, I do. Matter of fact, let me talk to them tonight." I didn't even know Christina, but I know that we need Native representation. We need all representation at the Capitol. And so that night, I called everybody in Lawrence trying to find a good candidate to run in that seat. And Christina's name came up, and we talked. I think our first conversation was like 3 hours, and just trying to tell her about, how important it is to have Native representation on every level of government. And she trusted me. And I gave her my word that I would be with her, right beside her every step of the way. And so here I am. We're like sisters now. And so I just want to introduce our lunch speaker again. I'm very proud of her, Representative Christina Haswood. Thank you.
Gat Shkaeda Shana Christina Haswood, Yenisha Torachi Nishla, the Bethlajin Bashast Eat Nash Ajatabaha Dashacheki Anya Shnella. My name is Christina Haswood. My pronouns are she, hers. I am Danette from the Navajo Nation, but was born and raised in Lawrence, Kansas. So I'm an urban native at that. My background is in public health, and before having that life decision of Pankui calling me and telling me to run for office, I thought my trajectory would be in public health policy and indigenous health policy, but I am quickly finding out that that's very much needed in our policy making. In that journey, I was really frustrated and started to see how being Native American was so politicized and so intertwined with policy. Growing up in Lawrence, my healthcare service provider is Indian Health Services, along with private healthcare insurances that my parents get from their employers, and having that experience really led me in the direction of wondering why a lot of what Congress is funding for tribal nations and our treaties, why all those benefits were going to the Navajo Nation. And with those, they were taking care of the people there, but a lot of times it didn't translate to us who lived off of the reservation. So I always had that curiosity, and state politics was an area that I started to get interested in because that's where a lot of the policy and laws are directly impacted with us, if those of us living off our tribal lands. So here's a little overview of what I wanted to talk about today. A little bit of Indigenous Kansas and the public health history of Kansas, just lightly cover, but you're probably wondering about all the bills and legislation. I'm going to focus on this past legislation with coming stepping a little bit out of the thickness of COVID-19, there has been some legislation, and we've probably seen in the state of Kansas and a state across the country too as well, that public health started to become politicized. And that was one of the main indicators that I wanted to run for office, because I was very frustrated as Indigenous people, and I was always taught that we're supposed to take care of our community, we're supposed to take care of our elders, we're supposed to foster the next generation, met with Western society, and oftentimes in the political realm of conservatism, it's very my freedoms, very self-centered in that way. So seeing that in policy and seeing the makeup of, at the time, only former state rep Ponkway Victor's Kozad was in there trying to advocate for us out of 125 in the House, and there's currently and still is there no Native American person in the Senate. It's a big uphill battle. So have you ever been somewhere and looked up what Indigenous lands you're on? Yes. So this is a common theme that there's actually a website called Native Land, and you can see through the diagram. With me being Navajo, I am a guest in this lands. I am not Indigenous to Kansas. I'm not Indigenous to the Prairie area. So please, if there's any information that I missay, please contact me. Happy to grab coffee and learn more, because I am a guest in this Indigenous lands. But we can see that Kansas was homelands to many Indigenous peoples. And I'm pretty sure that this graph, under the layers and layers of it, we can see Indigenous peoples who migrated from Mexico, now modern day Mexico, to now modern day Canada, all the way from the East Coast. It looks like from the state of Ohio coming into Kansas. Kansas was definitely an area where a lot of Indigenous peoples and tribes travel to. And so it's really interesting to see this Indigenous history pre-colonization. And during colonization, unfortunately, we lost a lot of our Indigenous ancestors and relatives. So just want to set that preface for this presentation. A little bit about Kansas public health. So if you believe it or not, Kansas was actually, for my young people, that girl. She was actually kind of one of the leaders in public health. So going from KU Med, we learned about Dr. Crumbine, who in the late 1800s, he was actually from Dodge City, Kansas. When you think about Dodge City, Kansas, it doesn't, in my mind, have that public health really spirit that I think of these days, but learning that there was a rural doctor named Dr. Crumbine, who back in the 1900s really led a public health campaign in his local area, in this rural area during the Spanish flu. Most popularly, he addressed the areas of there was a public drinking cup. Nowadays it's like, but he brought the awareness of that area that we needed to stop that. And oftentimes the public drinking cup from Google was this bucket of water, and everyone kind of just took a drink when they were thirsty. And then there was something called like this common towel roller. So I don't know if anyone's from Lawrence. Has anyone been to Checkers? So I grew up in the women's restroom. I don't know if in the men's restroom, but there was like this towel. And I always thought it was the coolest thing when I was younger, but going through public health and knowing how unsanitary it is to share a towel like that, especially in a public setting like a grocery store, he also brought the awareness of that. I guess that information didn't get to Checkers in Lawrence. And another thing was the Swat the Fly campaign, where he really addressed the issue of putting like netting on your windows and the common house fly, and just that idea that how insects and pests can get into your home and spread that contamination. So he was one of the leaders in his day, in his area, preaching public health and hygiene. We can kind of see similar areas of that during COVID-19, during the pandemic, of preaching hygiene, of washing your hands with this soap and water, hand sanitizer, wearing masks, and just keeping your germs to yourself. But with public health in Kansas and nowadays, I've been out of public health for a couple years, so feel free to correct me if I'm wrong, but a lot of the challenges is staffing. So Kansas is unique comparative to across the country that we are local and decentralized. So we have 105 counties in Kansas. That is a lot. That is a lot of counties. I don't know why 105 was decided back then, but it's currently becoming an issue because every county has the power to have their own public health departments. In Lawrence, our system is a little bit different through funding and the way the public health department functions in comparison to other parts of Kansas. Kansas is a big, big state. But now we see during COVID that public health was politicized. And this really angered me as a little public health student, that public health is a job that, when we're doing our job, we're grinding, we're writing papers, we're writing reports, we are tabling and getting surveys. No one really bats an eye, right? We lay low and we're doing our job. But during the pandemic, our bosses and our directors and our staffs, everyone was in the media, and that opened up to criticism. Again, that public health issue of my personal freedoms should not be jeopardized because of the greater good. So we saw that Kansas during the pandemic, our governor was actually, I believe, the first or one of the first in the countries to shut down schools. And that became a whole ordeal. So we can see now in legislation at the state level and other states as well that public health entities have too much power. And I think with Kansas, what was really unique is that the governor did the shutdown, then the legislature actually came back for a special session. The legislature, Democrats, Republicans, came together and said, yes, COVID's happening, we should shut down the state. So it was really great to see that bipartisan action at that time for the greater good. But also in my community, it came down to our county commissioners. Now, I ran with a couple of our county commissioners, and I said, I'm so sorry, you're making public health decisions because this is not exactly what you ran for. But they were ones deciding either weekly or monthly about mask mandates. And then, again, the public outcried, that's too much government control, especially in the school system. So in Lawrence, I'm not too sure if it's correct for other areas in Kansas, but our school boards actually ended up voting on mask mandates in the classrooms. And still, there was an outcry that that was too much government power. Elected officials are making decisions of my personal freedoms. So that's kind of where we're seeing in the Kansas State Legislature bills like the governor cannot shut down schools. The governor cannot do this. Local governments cannot do this. Only the state legislature can do X, Y, and Z, which is a really interesting shift and also very scary at the same time. Again, modernization of public health. So you probably heard things like Public Health 2.0. I don't know if there's like a 3.0, 2.5 yet, but they're always trying to modernize public health in the systems, and funding is always an issue. Funding. But now, if you're not from Kansas, KDHE our entity at the state level for public health, different to other states, where some states might have a separate column for health and separate column for environment. KDHE is trying to do both. And they are splitting their resources and times, trying to navigate everywhere across our state, right? It takes like 6 hours to cross our state, and get these reports. So that in itself has its challenges as well. So Native American public health issues in Kansas, you probably already have a list in your head of where your communities are, but these are just the list of issues that pop up in my head immediately from missing murdered Indigenous peoples here in Kansas. We cannot ignore the fact that we are in the middle of the country. We have international highways of I-70, I-35. These are often common transportation routes for all types of activities. Mental health, foster care systems, right? And maternal and child health. So there was recently a report that came out we already know, right? Indigenous folks are suffering at one of the highest for morbidities and mortalities during pregnancy, during prenatal care, and that access to prenatal care here in Kansas is quite limited. But yeah, we can keep on going on the list, and there's also more, right? Because public health, we don't just only treat the symptom, we look at things holistically, and we look at things from decades ago all the way to historical trauma. So I wanted to put this quote that I actually learned a month ago. So I'm kind of on the younger side of our state legislator, and I came in angry. I came in so enraged once you learn about all the policies and histories that happened to our peoples and the genocide. And, I've asked, what has the state of Kansas done? And policy-wise, don't get no data on what was previously enacted to the Indigenous peoples here to try and get rid of them. That all this makes me angry, along with sadness. So when I heard this quote, that to understand why fences were built in the first place before bringing them down really stopped me in my tracks. It made me take a deep breath and a couple steps back, that before I want to go burn everything down and start over, I need to know why these were here in the first place. Why were these policies here in the first place? A lot of these policies are decades and decades old. I'm only 29, so policies and issues that have been happening for 50 and 60 years, I rely a lot of that institutional knowledge on my older colleagues and folks who work in agencies and nonprofit areas that have different perspectives of the issues as well. So the legislative session this year, we run on a little bit of a 2-year term. So I'm in the House, so we have 2-year terms, and this is the first of the 2 years. So a lot of the bills that were introduced and have made it to a certain point in the process, you'll still see them next session. But some bills, like a lot of my bills that I wrote, got no hearings, got no attention. They're dead. So I'll probably have to reintroduce a lot of them. So here's a little statistic from the Kansas Legislative Research Department. If you go to their page and to the publications, and 2 little clickable links that says new, there's really a good resource called legislative highlights and legislative summary of bills. So that's where I get a lot of my information, because things get sticky. Things get really sticky and muddy at the end. And even for me, I don't know how former state rep Punkwe Victor's Kozai did it. I'm still trying to figure out how to map all bills. For example, a tax bill, there was 20 bills in it that ended up be putting in the last minute. So trying to figure out what exactly has been put in, what sentences have been crossed out can be a little hard. So only out of 800 bills were introduced, about 12.3% became law. And then in the House side, it says there was 474 bills introduced. About 5 of them are my bills that did not go anywhere. So that's a little perspective of how the state legislature, how many bills come in, how many bills get heard. We're actually a state where not every bill has to be heard. So it takes a lot of effort for, if you're working with a legislator on a bill, to get that community support and to kind of know who are the key stakeholders to talk to. If you're working on a bill or have bill ideas, I'm happy to sit down and chat with you and trying to draw those roadmaps of, how can we get this done? But I'm quickly learning that you can't solve the world in just 2 years. A lot of these issues take decades of work. So I'm going to highlight just a couple bit of policies. So maternal reproductive rights is currently under attack. Again, last August, we defeated an amendment that in our state constitution currently, abortion is a legal right. And there was an attempt to overturn that. With the Hyde Amendment for Native folks who seek healthcare services through Indian Health Services, we do not have that right to get an abortion at Indian Health Services, but only during the Hyde Amendment says if the mother's life is at risk of death. So I would say any reproductive policies that come from the state legislature automatically impact us. So we had a couple bills that passed this year. One was really concerning to me as a public health person that in statute allowed and required public healthcare entities that administrated abortion medication to have this misinformation sticker on like windows and doors that they were required by statute to have. And it had this this text of information of what it was trying to do. And the main research paper that was driving this legislation, and this is not unique to Kansas, this has happened in other states. We took a deep dive into it, and other state legislators and professionals have found that this research was faulty. This research said that it could not be completed because women were hemorrhaging. One of my colleagues in the committee, when we brought that point up, said, don't women always hemorrhage? So that is where we are having to deal with. And then, of course, the other legislation was HB 2313, enact the Born Alive Infants Protection Act. That's already federal legislation. It's been in federal legislation for several decades. So that wasn't too much of a different change. And then things like pregnant crisis centers are rooted in, I would say, religious activity, and there we're seeing legislation come in that are taking funding and tax credits that could be going to our local public health departments and taking away out of the pot from other folks who might provide more inclusive care and with less barriers as well. So I'm going to come back to that slide real quick, but I'm going to talk about our LGBTQ plus and two-spirited folks. There is a national political battle for discrimination and hate towards our beautiful relatives, and HB 180 actually was a bill that also sets up a foundation of discrimination towards these folks. So in my culture, I asked my parents about this and tried to learn a bit more about the Navajo way of how pre-colonization we would treat our two-spirited and queer folks, and it doesn't align with these policies. So I'm not too sure what the belief is here in Kansas, but I know that we want our peoples to be happy and healthy and live a good quality life. And then water. So with the Kansas 4 tribes, they are not in the western area where a lot of the action that we're seeing in the state legislature towards the Ogwalla Aquifer that we share with Colorado and those states. So a lot of the policies, we made some strides in the past legislative session of funding, but we need more funding to go to the water office. It has been unfunded for several years, too long. So having this investment in our water, but also when I look at urban issues to the water crisis is making sure that we have accessibility of lead and make sure there's no lead in our pipes and all that. So those are a couple of the bills. 2 minutes, okay, cool. So I am going to go to previous legislation. Me and former State Representative Ponkway Victor's Cozad passed HB 2008, which is the Missing Indigenous Peoples. I have a QR code if you want to get your phone out and zoom in and screen. I made it into a bit.ly link, bit.ly ks-mmip/training. This is the training-free program that came from this bill. It was recommended to state law enforcement to do this training. So if you go, it's on the University of Kansas, and you kind of add it to your cart. It's free, and then you should have access to the presentation. It's like a kind of like a training module. It's really cool. I liked it, and it was a really good moment to see government work for those moments to get this bill passed. And there was a lot of folks who helped testify for us, folks who are students, folks who are mothers, and folks who work in tribal entities. So it was really great to just see that work. But other barriers and solutions, I would say, is resources. So one thing I've noticed at the state level, I always thought lobbyists were terrible. Like, I thought they were evil. But in the Kansas State Legislature, I'm seeing that that's not always the case, but also how important it is to have a lobbyist in the Capitol every single day or most of the time. I only sit on 3 committees, and in the House, there's 30. In the Senate, there's no Native person over there. So a lot of times things fall through the cracks. And there's been several times where we had to, help hurry up and tell the other side, like, this is really bad, this is really bad. And they're like, why didn't you tell me? Like, because I was, on my other committees and I didn't see it. Moral of the story is we need more Indigenous folks in these spaces, not only as elected officials, but also in research, policy, folks who are going into law, even just folks who might want to help me comb over through bills. So we're seeing in the foster care system, we have a new House committee. A lot of times they'll put in ICWA, but sometimes they'll forget. So I need that extra hands of help of combing through that legislation to make sure that we have our T's crossed and our I's audited. So that is just a brief little bit of public health policy in Kansas. Thank you for your time today. That's my contact information. You can follow me on my social medias as well. And thank you for your time.
Let's give her a big round of applause. We got a... And we've also got a gift for you here. Thank you for your time here, coming here today. And can you hang on for a little bit in case anybody wants to talk to you afterwards? And this is from Catch, K-A-T-C-H. So let's give her a big round of applause. Representative Christina Haswood, the Dane Nation, and currently serves in the Kansas House of Representatives for House District 10 and serves on the committees Federal and State Affairs, Health and Human Services, Taxation, and the Joint Committee of State and Tribal Relations. She is currently in the House Democrats' leadership as policy chair. One more big round of applause for Christina Haswood. Thank you.